Hello, my name is Representative Pam Powers Hanley, and I represent LD9 in Tucson in the Arizona House. Well, today is Saturday, May 16, and a couple of days ago, the House Health and Human Services Committee met online to hear from several experts who are interested in opening up the economy in multiple states, including the state of Arizona. You might have seen my blog post before the meeting. The Democrats were complaining that we should hear both sides of the story rather than just hearing the people who think it's safe to open up. Maybe we should listen to some of the public health people who are more cautious about opening up. So anyway, the meeting wasn't quite as crazy as I thought it was going to be. I mean, it was a very interesting discussion. We had two scientists from California who have done recent experiments, and both of their experiments, done one in Northern California and one in Southern California, are that the coronavirus spread is much more widespread in the United States and across the world than anybody ever thought, and in fact that it could have been started in the United States as early as November 2019. Their other point is that most of the people who had it didn't even know they had it because they had so little symptoms, or maybe they thought they had the sniffles or whatever. And so what they're saying is that the spread is much wider than we think, and then that makes the death rate much lower. But who's dying? It's the old people, right? And so their idea is that since it's the old people who are dying, the rest of the people can go back to work and back to school, and they might get sick, but they're not likely to die. They still could die, but they're not likely to die as the old people. And so I asked them a question about keeping the seniors in assisted living and nursing homes safe, because obviously we have caregivers who are going in and out. Sometimes caregivers work at multiple facilities, and so these caregivers could go out and party on Friday night on 4th Avenue or on Mill Avenue in Tempe, and then go to work the next day at the care center and infect grandma and grandpa, who are very vulnerable for dying of COVID-19. And so one of the presenters did give quite a lengthy list of things that we could do to keep seniors in assisted living and nursing homes safe. And most of these things we're not doing in the state of Arizona. But I got to thinking later, their emphasis was on keeping the 3% of seniors who are in assisted living safe. But what about all of the seniors who are out wandering around, right? There's more seniors, especially in Arizona, who are not in facilities, right? So what's their risk of dying? So what really is the risk of dying? Is it if you're old? Or is it if you're old and have a pre-existing condition? Or if you're old and have a pre-existing condition and you live in a facility? Or what is the risk if you compare somebody who's 45 years old, has diabetes and is overweight, with somebody who's 65 years old and has diabetes and is overweight? Both these people live in the community. Do they have the same risk of dying? Or is it that, community facility? Is that the key? As a community facility and the spread, because they're all so close together. So again, I think it's too soon to open up. I think we need to look at this data more closely. I don't think grandma should be asked to take one for the team.